Do you see echo laser ablation becoming a more widely available office-based treatment for prostate cancer? And what needs to happen for that to occur?
It's tough. The prostate cancer space is extremely competitive. And the problem is that there's several modalities, right? Different approaches. And many institutions have already invested millions of dollars into certain technologies. So the problem is when you have multiple types of treatment options and they're very expensive, fluidity and change between these modalities is not going to happen easily, right? Because if you've got a hammer, everything becomes a nail, right?
Mhm.
And so I think that's going to be the biggest resistance. What's nice about echo laser is that it's relatively very inexpensive and it can be done in an office and ambulatory surgery setting. So I feel like it's going to spread very rapidly because of that advantage. So this will allow small prior practice physicians, smaller groups to invest in this and later on larger institutions. An example of this is I just got back from Brazil. I was invited to train about 60 urologists on how to use echo laser ablation for BPH and for prostate cancer in the SUS, the government free healthcare system in Brazil. And the reason Brazil found this very attractive is that it's very low cost. So when you look at the per patient cost, it's about $1 or $2,000, which is
Wow.
incredible. So when you are talking about a modern technology that's very precise, but more importantly, is very easily deployable, doesn't require a lot of expensive equipment. These are ingredients for very rapid dissemination and acceptance in, especially in socialized medicine systems. So what's really interesting is, we did the first 8 cases in Rio about 2 weeks ago. So I did 8 cases, 4 hospitals, trained 60 surgeons. It was crazy.
Oh,
And so, but extremely rewarding because I feel like it's rare that new technology actually comes in way cheaper than existing technology. That doesn't happen very often. Echo laser is going to spread very rapidly, not necessarily by choice, but driven by a lot of financial factors,
yeah.
and these outcomes are going to start to get published. So there's several centers popping up in the U.S. I train most of the surgeons who are doing it in the U.S. and there are multiple centers every month. We're training more and more physicians. So I think we're going to see rapid dissemination, and it is going to become a lot more accessible. Obviously, they're going through the process of getting it covered by insurance. It's close to it, and in
Yeah.
some cases, it is getting covered. So I feel like what's also going to make it easier for insurance coverage is again the cost. This is going to come in way, way cheaper than radiation, surgery, any of the standard therapies that are out there. And unfortunately, in life, cost is a major factor.
Sure.
I think in this particular situation, it's going to be a win-win for all parties involved.